Hi everyone, this video will be helpful to you to learn about the different kinds of comfort devices. I am Jeneline Bernard, working as tutor in College of Nursing. This presentation will help the learner to gain knowledge about the definition of comfort devices and the uses of various comfort devices. Comfort can be defined as follows. Comfort is a sense of mental and physical well-being, and also it can be defined as comfort is a state of physical ease and freedom from pain and constraints. Comfort devices are the articles which would add to the comfort of the patient when used by relieving discomfort and helping to maintain correct posture. Comfort devices are having several purposes. It is helping to relieve discomfort. It is used to immobilize the body parts. Also, it is helping to relieve pressure on parts of the body. And it is serving the purpose of protection. That is, it is helping to prevent the falls and accidents. Pillows are the very basic and common comfort device which is used not only in hospitals, also at home. Pillow is a rectangular cloth bag stuffed with cotton, foam, rubber, feather, etc. It is used to support head, neck, arms, legs and back to aid comfort to the patient. Skillful arrangement of pillow to support the normal anatomical groove will prevent strain and fatigue. Pillow aids in reducing the pressure on body parts. It can be folded, rolled or tucked firmly against the body to maintain the proper position. Cardiac table is a device designed as an overbed table and is placed in front of the patient while they are in Fowler's position. Cardiac table, either made up of iron or wood, may be placed over the bed or rolled over the bed. It is used by cardiac patients who can lean forward with a pillow. This is also used for writing purposes. It is useful for serving food and other self-care activities to patient. Backrest. Backrest is a mechanical device which is made up of metal or wood, provide a suitable support and rest for the back of the patient in sitting position, which may be either adjustable bed or adjustable backrest. It helps to facilitate easy breathing. It is very commonly used for cardiac patients, patients with respiratory issues like asthma, and also it is used in post-operative period. Side rails. Bedside rails are safety rails along the bedside that protects the patient from falling off. It also helps patient to reposition them in the bed. It is also called as cot sides. Adjustable cot. Adjustable beds are aiding in positioning the patient. This is available in two different types, that is, it is working manually or it can be worked through remote control. With the help of remote, patient can adjust the position of cot by themselves. This type of cots are replacing the need for backrest, knee rest and bed blocks. Also, the height of the cot can be easily adjustable in this type according to the need of the healthcare provider or the patient. The hospital beds are provided with the regular mattress with Rexin cover and also with the air mattress or water mattress for patients those who are prolonged bedridden and at risk for pressure ulcer or decubitus ulcers. There are different types of air mattresses are available in the market. Alpha beds are the medical air mattresses which is used for the decubitus pressure ulcers. It is containing bubble pads and having the system of alternating the pressure inside it. The bubble pad structure provides effective treatment by allowing more variation and distribution of pressure areas beneath the patient compared to row by row pads. Triple mattress. It is also air bed which alternates the pressure on the body. It is connected with an external pump which alternates the pressure in the different tube-like compartments, allowing for pressure to alternate on the skin. By this, it is reducing the risk for pressure ulcers. Water mattresses are the vinyl bags similar to mattress shape which can be inflated with the use of water. Naturally, it conters to body, helping to evenly distribute pressure over the entire body, which helps to reduce the pressure over joints and pressure points and gives less stress and strain on the muscle. It does not require to change the water very frequently until we need to move the mattress from one place to another place. Bed cradle. Bed cradle is a frame made up of iron or wood placed over the bed to take away the weight of the top bed clothing and to prevent the sheet or blanket from touching the patient. For example, burns patients and also patient with plaster of Paris which need to be dried, and it is also used for patients those who have undergone the amputation. Just to protect the stump wound, we can use the bed cradle. An overhead trapeze is a triangular shaped metal bar. It hangs from the metal frame which is attached to the head border or the foot border of the bed, which is helping the patients to grab and move themselves on the bed. Very commonly, it is used for the ortho patients who cannot get out of the bed. Abduction pillows. A pillow or a cushion wedge placed between the legs of the patient to maintain the proper position, that is, to keep the legs in the abduction position. It is helping to prevent the dislocation of hip joint. It is very commonly used in certain congenital disorders which is related to hip, and also it is used for patients those who are at risk for developing the hip dislocation, and very commonly it is used in the postoperative phase of the total hip replacement. Sandbags. A sack or bag filled with sand can be made into various sizes. It is used to immobilize a part and relieve discomfort. It is also commonly used in the treatment process of ortho conditions to apply the traction. Cotton rings. Small cotton rings are made to relieve pressure from certain parts of the body like elbow and heels, which is prepared by the cotton. Nowadays in the market it is available with the preparation of rubber also. Air cushion. They are round in shape and made up of rubber. These can be inflated with air. These are used to take off the weight of the body. Air cushion should not be applied directly in contact with the skin. They should be covered with a linen cover. There are several purposes. It helps to improve the circulation. It is providing comfort to the patient. It is helping to prevent the pressure sores, especially over the sacral and coccyx region. It is used in very thin or very obese patients and chronic bedridden patients also. Trochanter rolls. Trochanter rolls are made by rolling bath towel or bath blanket into such a shape that keeps the axis parallel to the articulating surface, so the axis can remain stationary, thus enhancing the support. It is very commonly used to prevent the external rotation of the legs for patients those who are in supine position. Footboard or footrest. A wooden block or board that provides support to the foot to prevent the foot drop. Keeping the foot in correct angle would prevent the fatigue. Knee rest. It is suitable to maintain the knees in the flexed position. It will be kept just behind the knees so that the patient can remain in the knee flexed position. It gives relaxation and thus relieves pain on the abdominal muscles and on tendons beneath the knees. Hand rolls. Hand rolls are made up of cloth that rolled into a cylinder about 4 to 5 inches long and 2 to 3 inches in diameter and stiff and firm. It helps to keep the fingers free on being held tightly to make a fist, and also it is helping to place the palm in position. It aids to maintain the flexion on knees and ankles. Foot elevators. It is a firm polyurethane foam in spiral cut design with hook and loop. It is so useful for patients with heel and ankle ulcers and also sores or injuries at the foot. It helps to promote the circulation by supporting the foot and relieving pain and aiding the comfort. Bed blocks are made up of wood or metal, which is used to raise the head end or foot end of the cot. In this, we can see the patient hand is kept in between two gloves. It is described as hand of God. It was done by a Brazilian nurse. She used the gloves, which is filled with warm water, to create the human touch for her patient who is affected with COVID-19 and isolated from the family members. If really we have the concern with the patients, even a small little things, small little actions can do the great things for our patient to ensure their comfort. In this session, we have learned about comfort devices, different kinds of comfort devices and their usage, like pillow, cardiac table, backrest, adjustable cot and mattress, which can be air mattress or water mattress, footrest, knee rest, trapeze bar, bed cradle, trapeze roll, hand roll, cotton ring, air cushion, sandbag, bed blocks, leg and foot elevators. In the hospital, our patients got admitted with different kinds of illness, pain and discomfort. By using all these devices, a nurse can promote the comfort of the patient other than pharmacological remedies. For this video, I have referred the Nursing Foundation textbooks and also from the internet. Hope this session will be useful to you. Thank you for listening.